Hello friends, I am Dr. Hyamavathy Raje, consultant breast surgeon at Sagar Chandrama Hospital, Bangalore. I am involved with diseases of the breast, especially breast cancer. As we know, breast cancer has been very common in India, but it is rising rapidly and it is now become an epidemic. Over the decade, it has increased at the rate of 1% every year. And not only that, we are dealing with patients who are very young. Breast cancer used to be a disease of the old, the 70s and the 60s, but today it afflicts young girls as young as the 30s and 40s. And not only that, we have to see that they are the aggressive type. What used to be aggressive amongst the black population in the US has now affected our women. Why is breast screening so important for India? Now we have a very large young population. We have a lot of young women who are contributing to the economic growth of our country and who are educated and trained in many professions. We would not like to lose them early. Apart from the loss of the human being, apart from the loss of the mother, a sister or a daughter, they also contribute in large sums to the economic betterment of the family and the country. Therefore, it is most important that when dealing with breast cancer, we have to keep in mind a few points. The first talk will be on breast awareness. It means that breast is just a part of your body and you have to be aware of the diseases, for that is the only way to get these diseases picked up early. Our society is a closed society, and unlike the West, you do not find open discussions regarding breast even among women. This has to change. Even children and grown-up girls in the higher universities should be aware that they have a breast, it can be affected by disease, and one has to keep a watch for them. How do you do it? You do it by what is known as self-examination. A good doctor can teach you a self-examination so that you will be the first one to detect any disease in the breast, especially cancer. By the time a patient reaches a doctor in India, we are already in stage 4. Stage 4 not only affects the life of that patient, but it adds to the economic costs, which will include surgery, chemotherapy, radiation, endocrine management, and some of them may be so late that we would not be able to even operate on them, but we can only go for palliative care. This is the aspect of breast cancer which we want to avoid, and we want to bring it down to zero. How do we do it? We do it by breast awareness and breast checkup. Now, breast checkup camps are being held in many centers and many hospitals. Besides, you can always walk into a breast clinic and ask for a breast checkup if you are worried about any breast problem. It would be good to take a sound medical advice rather than Googling all your symptoms on the net and landing up with a host of issues. Googling to find out and diagnose breast cancer is the last thing you have to do. The second factor in the case of breast cancer is that many patients believe that they will never get the disease. And when you confront them with the diagnosis, there are two ways of looking at it. Either they are totally shattered, so they go back into their own cave, or they decide that something is wrong with the doctor because I cannot have breast cancer. The diagnosis of breast cancer has a protocol, and a doctor who follows this protocol usually arrives at the right diagnosis. Therefore, it would be best in the interest of the patient to believe the doctor and to follow all the orders that are given, including the minimal testing which will have to be done before one arrives at a diagnosis. Having diagnosed the disease, there are many ways of approaching the problem. If it is early, as we put it as staging 1, breast cancer is curable. And therefore, it is best that you are picked up at the stage 1, you are treated with as per the instructions of the doctor, and it is likely that it is not affecting your lifestyle. As the stages increase, the lifespan of the patient falls, the mortality and the morbidity rate increases, and one is faced with a patient who is sure to die from the problems of breast cancer. It's spread in the body and affecting other organs. To avoid this, we need what is known as the breast checkup, a breast awareness, and third factor is a breast surveillance. The breast surveillance means that in case a woman has a lump which a doctor is suspicious about, who has done the tests which are necessary but which have come as negative for cancer now, may need to be followed up very closely with extra tests, with extra mammograms and other biopsies to be repeated till the curiosity is confirmed, because this is most important that we get them early. The Western countries have reached a stage where their check mammography is able to detect very early cancers before they can be seen and felt. They are not at that stage, but at least we can detect cases early. We have doctors around, and it would be best that if a woman is suspicious about her breast, she seeks proper treatment as advised by a trained professional. Do not go for studying breast diseases from the internet. It is always bound to fail you. Thank you.